The health history for someone with irritable bowel disease would include chronic constipation, diarrhea, or both. This person would probably be complaining of some lower left quadrant pain, as well as some abdominal cramps and pencil-like stool with mucus. For someone with diverticulitis, their pain may be somewhat less severe, more of a moderate and dull pain. They would also have this pain in the lower left quadrant of the abdomen and possibly while straining to have a bowel movement. The patient might also report some mild nausea, fever, and gas, possibly some intermittent constipation, as well as rectal bleeding. They may also have some abdominal distension and bloating. As for appearance, a person with irritable bowel disease may appear completely normal on the outside, while someone with diverticulitis may be in distress. Okay, I'm going to start by examining the posterior chest. I'm looking at how the chest is moving, if it's equal. I'm looking at the respiratory rate, and I'm assessing the breathing pattern. To check for symmetry in the chest, you put your thumbs at T9 and T10, and you're going to pinch some of the skin at the spine and have the patient breathe in deeply. Can you take a deep breath for me, please? To assess the costo-vertical angle, you're going to take a hand, place it at the spine where the spine meets the rib cage near the kidney, and then hit your fist against your palm, and if the patient experiences pain, that could indicate something is wrong with the kidney. So to auscultate the posterior chest, you're going to start at the top intercostal space, the first intercostal space up here right above the scapula, and you do each side. Take a deep breath and out. I'm going to listen to the anterior chest, starting at the clavicle up here. Deep breath. Deep breath. And we're going to go down. So next I'm going to check his nails for color, consistency. I'm going to check for capillary refill. It's less than 3 seconds, showing that he has good oxygen. I don't see any clubbing, which would indicate hypoxia. Skin turgor. Let's see. He has good skin turgor. He's not dehydrated, and you can palpate it. As well as listen to it. I'm going to auscultate your heart sounds, starting with the aortic valve, which is in the second intercostal space on the right. And you're going to listen for 30 seconds. If you hear any abnormal sounds, you would listen for 60 seconds. And then you go over to the pulmonary valve, which is on the second intercostal space on the left. And then the tricuspid valve is the fourth intercostal space on the left, and the mitral valve is the fifth intercostal space on the left. I'm going to assess the radial pulses and the brachial pulses. Can I see your arm, please? And then the brachial pulse. When you're assessing the abdomen of someone with diverticulitis or irritable bowel disease, you're going to first look at the color, contour, and symmetry of the abdomen before auscultating. Then you're going to auscultate each of the 4 quadrants, starting with the lower right, then going up to the upper right, over to the upper left, and then the lower left. And this is where the pain's going to be in someone with diverticulitis or irritable bowel disease. You're then going to want to palpate lightly and then more deep on each of the quadrants, asking if there is any pain or tenderness in each of these quadrants. With someone with irritable bowel disease, they're going to have normal bowel sounds. They're also going to have tympany over the gas-filled area of the bowel. And then someone with diverticulitis, about 70% of patients report that pain in the lower left quadrant, as well as nausea, low fever, and a palpable mass.